Good morning, and welcome to Look and Feel Your Best with Dr. Patrick Flaharty. I'm Gina Burch. This morning, we're going to be spending the next hour telling you how you can look better. And we're going to be talking about specifically surgical procedures. And in turn, that'll definitely make you feel better when you look in the mirror and see, wow, I can actually see my eyes again.
Right.
Good morning, Dr. Flaharty.
Good morning, Gina. How are you?
Great. So Dr. Flaharty is the medical director of the Azul Cosmetic Surgery and Medical Spas with offices in Fort Myers, Naples, and Bonita Springs. And while he does a ton of non-surgical procedures in the office, and that's really, I think, where you said much of the growth is for you right now, the gold standard still is surgery. I mean, when you really want to make it perfect, that's where you go.
So, we spend a lot of time talking about new technology and all the things we can do in the office, and that's an exciting, growing area in our field, for sure. I mean, almost every week we have something new to talk about, whether it's Coolsculpting or the Halo or Microchanneling. And
you name it.
Yeah, right. And so, that's exciting because there's more and more that people can do without surgery, without downtime, and it's been a fast-growing segment. However, there's still certain things you can only accomplish with surgery. And on the surgical front, there's been, equally amazing developments and progress made in terms of improved results with less downtime, more natural results, more comprehensive results. And I've never been more excited to be a facial cosmetic surgeon than I am today, because the tools I have now are so much better than what I had when I first
imagine.
started this 20, 25 years ago. So, and the things we're able to do for patients in a single setting, a single treatment is greatly expanded with the technologies, most notably endoscopic brow lifting, which is a much quicker, less invasive way to rejuvenate the upper face forehead, fat augmentation, which is using your own natural living fat to replace the lost volume of the face. So much of facial aging is actually volume loss. It's not just loosening of the tissue, it's loss of volume.
Yeah, well, it gets loose partly because there's nothing to fill it up anymore,
exactly,
right?
like a deflated balloon, which we always use that analogy. And so being able to restore volume makes a huge difference in being able to make people look younger. As we get older, we get more gaunt and hollow, so correcting that. And then fractional laser resurfacing, which is a gentler way to tighten the skin and reduce wrinkles and sun damage in a single treatment, which can be combined with facelifting and fat augmentation and lids and brows to give you this really comprehensive result. And so that's something we just couldn't do, 10, 20 years ago. And now I do it, almost every day, where we'll do, an endoscopic brow lift, maybe eyelids, lower face and neck lift, fat augmentation, and laser resurfacing, which is, the whole shebang. And in 2 weeks, patients are healed and look amazing. You know? And you haven't left anything undone. So, the entire face, it's lifted, it's reshaped to a youthful shape, it's restored in terms of volume, and the skin is rejuvenated, and it looks wonderful.
And what you said was key. It's a 3-dimensional rejuvenation, because back in the day they would just tighten, but they wouldn't fill. They wouldn't look at the full.
Yeah, if you think about traditional surgery, it was, probably a lower face and neck lift. So, it helps your jowls, it helps neck laxity, but it's only a partial improvement because your mid-face is deflated, your cheeks, you may have eyelid changes, the brow may be heavy. So you still have hooding around your brows, and brow lifts were much less common in the past when they were open lifts, because it was, a much more, a lot more cutting, a lot more stitching. Patients didn't really want that. So people would say, no, thanks, I'll just do the lower face and neck lift. So with the endoscopic brow lift, we can do things with very small incisions hidden in the hairline. We don't even remove any skin. We just, kind of reposition the brow to make it the shape more youthful, and then restore the volume, which we do, in the brow, in the eyelids, in the cheeks, in the jawline, and that's a huge part of it. And then adding, the skin tightening element. So, we can walk through these things all individually, and, obviously you don't have to do everything at once, but, more and more, that's what I spend a lot of my time doing, because
harmonious rejuvenation,
right? When people get to a point where they're like, oh, I don't really like what I'm seeing in the mirror. I'm playing golf or playing tennis or playing pickleball, and I feel really healthy and I feel very energized, but then I look old in the mirror. Usually it's a lot of these things all at once. It could be your, eyelids, brow, mid face is hollow, sun damaged skin, some jowling, neck laxity. So when we can reverse all of that in one procedure and do that under IV sedation, not general anesthesia, we do use a licensed surgical center for your comfort and safety. But all these things can be addressed in a procedure that is, if we do everything, brow, lids, face, neck, fat, laser, about 3 to 4 hours, but you go home that day, you come in the next day, and, the new skin's healed from the laser in about 7 days. And usually by about 10 days to 2 weeks, people are out and about again and have, a complete rejuvenation. You haven't left anything undone, which is one of the beautiful things about it.
Right. So you've had one downtime, one surgery, and the reason why you can do this now, as opposed to why you couldn't do so many things in the past, was you brought up the best example, the endoscopic brow lift, where before that would have taken hours, where now it just takes half an hour.
Right.
Yeah.
30 minutes to do that. Right. And better anesthesia too.
Mm-hmm.
We have better sedatives, better anesthesia techniques. So, better surgical techniques. We just understand the anatomy better. We can do these procedures in less time, with less swelling, less bruising, less downtime. So go ahead.
I was going to say, let's start breaking it down a little more, because I mentioned endoscopic brow lift. We're going to get to that in a minute, but let's start with the eyes, because that is one of the main things that people come in to see you about. I mean, that's one of the first things we notice, because we are looking at ourselves in a mirror, and we see those. They're looking back at us, and you see the heaviness, and you see the lines and the crow's feet, and it's like, just make those better, please.
Yeah, so eyelids tend to be sort of the first area to age on the face, because our eyelid skin is really thin. It's the thinnest skin on the face, and with blinking and rubbing your eyes, you will get some crow's feet and some redundancy of the upper eyelid. So you tend to start to see looseness, wrinkles, heaviness, hooding around the eyes, dark circles under the eyes from some of that volume loss we talked about. So eyelid is an area where it can be a standalone procedure, and many times is, because patients will often come in to have their eyelids done perhaps before they need other things done. So in the upper eyelid, as we start to get that redundant skin, starts weighing down the lid margin, creating heaviness and hooding. And so trimming out some of that extra skin in the upper eyelid can get rid of that heaviness and hooding and give you a little bit more bright-eyed appearance. Your eyes look a little more bright-eyed and open. And that heaviness, because it tends to kind of weigh down the outer corners of the eyes, can make us look sad or tired as well. So it just makes you look tired. And so that's one aspect of it. But also it can affect vision too. If your eyelids get heavy enough where the skin is drooping over the edge of the lashes, it can weigh it down to the point where you're losing vision. So removing some of the extra skin of the eyelids can make the eyes more bright-eyed and open, help you see better, help you look better. It's sort of a win-win. And
that's a fairly easy one to do, right? Because you just go right into the crease of the eye and take out that extra skin?
Yeah, it's a delicate procedure, but it is quick and easy in the sense from a patient perspective. Again, just a little bit of light IV sedation so the patient doesn't have to feel any of the numbing medicine. I had a patient just this week who had some memory loss from anesthesia, just didn't want anesthesia, so we just did it with local, and it's fine. You just numb up the eyelids. He felt it when I numbed up the lids, but once it's numb, then he doesn't feel it. And he was awake during the procedure and did fine. So you just trim out that extra skin. If there's a lot of extra fat, we'll sometimes remove fat just to get rid of some of the fullness. But more and more we recognize you lose fat from your face with age. We're not trying to accelerate that aging process. We want to preserve fat wherever we can. So more times than not, we'll shrink the fat or maybe just trim a little bit, but not really remove much. And then close with a little delicate stitch. That stitch will come out a week later. The beauty of eyelid surgery is there's very little discomfort. Most patients are really surprised about that. There's very little discomfort. Skin is very thin. The downside of eyelids is that it's front and center on your face. The skin is thin and the skin is loosely adherent, so that means it can swell easily. As you've seen, anybody who's gotten punched in the eye will get this big swollen eye. So we have patients avoid blood thinners like aspirin or aspirin-type products, use a lot of ice on the eyes that first day, especially try to keep the swelling down, and that makes a big difference. So we do some icing for a couple of days. And whatever swelling or discoloration you get in the first few days will kind of go down into the lower lid, gradually disappear over the course of a week or two. Sunglasses can help that a lot.
What about the lower lid? What do we do to address that? Does it always need work when you do the upper lid, or might?
Not always,
Okay.
no. So, I mean, we look at the lower lid as well, and the aging changes we can see there. One of the earliest is hollowness, those dark circles under the eyes. And the good news about that is that can be fixed without surgery. We just use a little filler. We have very specific fillers that work particularly well for dark circles under your eyes, and that can be layered in with a technique we call the cannula technique. It's a blunt-tipped instrument that can just fill in that dark circle and correct that and nicely rejuvenate that area of the eyelid. So that's a really nice technique, which we do in the office, virtually every day, but can do it at the time of surgery as well. Beyond that, sometimes people will get excessive fat in the lower lid where they get bags, and that makes them look really tired. And so if it's too much fat, we will trim out some of that fat from inside the lower lid, and that's an elegant procedure because we're not making any skin incision. There's no stitches. We just go on the inside of the eyelid. We trim out the extra fat to flatten that area out so we don't have those big bags causing us to look really tired.
Amazing. Yeah.
Right. And then the skin would be the third element. And if there's some extra skin, we can just do a little trimming out of the skin. We call that a pinch technique. We just tighten up the skin right under the lashes. If the skin is wrinkled, we can tighten that with either a chemical peel or a laser peel to smooth out some of those lines and creases. So there's several little maneuvers in the lower lid we can use to fill in dark circles, reduce extra skin, get rid of the bags, all to help you look more rested.
Right. And sometimes when your lids are heavy, there's a whole nother reason for that. And we're gonna talk about that next, and where it comes into play with making your eyes look better, and that's that endoscopic brow lift that you were teasing me about earlier that we were talking about. So that like throws another little monkey wrench, but not a bad one, a good one into it when we're talking about eyelids. So when we come back, we'll talk about that a little bit. So you're listening to Look and Feel Your Best. Again, Dr. Patrick Flaharty is the medical director of the Azul Cosmetic Surgery and Medical Spas in Fort Myers, Naples, and Bonita Springs. I still want to put you in Sarasota. I keep wanting to say that. That's a habit I have with you. So if you want to, during the break, look on the website and you can kind of see some before and after pictures of some of the things that we're going to be talking about here.
Yeah, it's a great place to get information about any of these procedures in greater depth and see some pre and post apps, which is really a good way to learn more.
Excellent. AzulBeauty.com. That is with a Z, by the way, AZUL, AzulBeauty.com. Also, you can write down the phone number 239-415-7576. And we will be right back with more of Look and Feel Your Best. Welcome back to Look and Feel Your Best with Dr. Patrick Flaharty. I'm Gina Burch. This morning we are talking about modern surgical rejuvenation and how it can apply to you and all the great new things that make going into surgery for turning back the hands of time even easier and more efficient than it's ever been in the past. And we're just talking about eyelids and how they can be droopy and heavy and affect your vision and definitely make you look older and tired. But there's something that kind of comes into play also when we're talking about eyelids, and that's the brow.
Right. Yeah. So a lot of times people come in to see me regarding heaviness of the lids to discuss eyelid surgery. And obviously one of the things we need to do when we evaluate that patient is assess the eyelids, how much looseness of skin is there, but also assess the brow, because if the brow is really heavy, that will make your eyelid appear very heavy. And often people will think, okay, it's just my eyelid, when sometimes it can be the brow. Now, in fairness, most of the time it's a combination of the two, because with gravity, our eyelid gets heavier, we get redundant skin, and the brow will descend too. And so the important part of that evaluation is assessing the eyelid, assessing the brow, and then looking at the options, which really come down to doing an upper lid blepharoplasty, getting rid of some of that extra skin of the upper lid, or doing a brow lift to lift the brows and forehead. When you do a brow lift, sometimes you don't need to do the upper lid blepharoplasty because that's lifted the tissue for you. And sometimes both are so heavy that you have to do a brow lift and a blepharoplasty at the same time. And so that's in, kind of the algorithm. And I've given that talk at national cosmetic meetings for a few years, because that's an important area of assessment when patients come in with these aging changes of the upper face, to determine what's the best path forward, and then discussing it with the patient. And, obviously sometimes we have patients where they could do a brow lift or do the eyelid, and there's pros and cons to those different approaches. which we discuss with the patient. But it's very important to look at the brow. I think a common mistake is made where everybody who has loose skin on the eyelid gets a blepharoplasty, and if their brow is really heavy, all you've done is accentuate the fact that their brow is heavy. Sort of interesting, when you do a blepharoplasty of the upper eyelid, you take out that extra skin. The brain knows when the eyelid is heavy, and what it does is it activates the frontalis muscle, which is the forehead muscles, and that lifts your eyebrow. And when you take away some of that extra skin, then the brain recognizes that it's not so heavy anymore, and it relaxes the frontalis muscle, and the eyebrow will relax and come down. And there's been some studies that have shown that the brow will drop about 3 millimeters after an eyelid blepharoplasty, just because you relax that muscle. It's not conscious, it's subconscious. So, if the brow is already heavy, moderately heavy, or really, really heavy, and you take away that loose skin of the eyelid, you're going to make that heavy brow even heavier. And you can get a very suboptimal cosmetic result where you've removed the extra skin. Sure, the skin isn't hanging over the lashes, but the eyebrows just about are, and they're down right on the eyelids.
Wow.
And that doesn't look very good. So, looking at those things, and the shape of the eyebrow complex is, everybody's different. Everybody is unique. There are some patients who may have a heavy brow, but because they're so hollow, when you lift the brow, it doesn't look good because they have so much hollowness. And so it's better to leave them with a little bit of a heavier brow and just trim out the extra skin. So you have to look at each person individually and say, okay, what is the best way to help this patient look the best? What are the best options? And then discuss that with the patient and kind of move forward on those grounds.
And the technique for doing the brow lift, as we were talking about in last segment a little bit, has really improved, where you do not have to remove skin. You can't even tell where the incisions have been made up along the hairline. I mean, it's pretty impressive.
Right. So let's say somebody has a heavy eyelid and a heavy brow, and we, after discussing it, the patient decides they want to have, both a brow lift and a blepharoplasty. So what we do is we mark the area. In a brow lift, we'll just make 4 small incisions. They're about 1 centimeter in length. They're hidden in the hairline. We don't shave the hair or anything. We just part the hair to make these incisions. And then we release the brow. We use these very delicate instruments to release the brow. So you're releasing all the tissue off the brow bone from the temples, and that allows that to be freed up. Now, how do I know it's freed adequately? Because we're not opening it. We're doing it internally. We use an endoscope. So an endoscope looks like a really long pencil that just slides in there, and it's hooked up through cables to a video monitor, so we can see the inside of the brow without having to open it up, and that's what's called endoscopic.
Very cool.
So yeah, it's very, very cool. So you can release all that tissue. You can visualize it to make sure it's released adequately on both sides and symmetrical. And then the brow really is just free to slide up. You can take your forehead and slide it, but obviously it won't stay because the tissues are tethered to the bone. But once you've released that tissue, then you're able to slide the whole brow up and hold it in a position that you want to achieve the height, shape, and contour that you want to achieve. There's a really great technological innovation, a little device called an endotine, and that's a key one. So once you've done this symmetrical release and verified it, with the endoscopic visualization to see that things have been released adequately, then you can take this little endotine, which is an absorbable device. It attaches to the bone. You make a tiny little hole in the bone with this hand-held drill that you can make a small little puncture, and it fits right in there snug. And that allows us to lift and shape the brow. So we put one on each side up by your hairline, and that holds the brow into position.
And then you can tighten it as you go to lift it?
So you can tighten it as much or as little as you want, but these are sort of the fixation points.
Okay.
So you put these in, and you lift the brow up over the top and attach it, and then it holds that into place while the brow heals. So the brow will heal down on its own because the periosteum, which is this really tough inelastic layer that attaches to the bone, that's what we're lifting and sliding that up. And then that will re-adhere. And it probably re-adheres pretty quickly. Really, within a few days, it's pretty stable. And by a month, it's very stable. So these endotines, we really don't need them to be there that long. We want them to be there long enough to hold the brow in the exact shape we want. So when I do the lift and fixation of the brow, I'll hold the patient's head up and I'll look at the height, shape, and contour, and I can adjust up or down on either side to achieve the result we want. But it's very, very accurate because once you get it right, it just holds it into place and it'll seal down and stay in that position. So it's been a quantum leap forward in terms of accuracy. So we're making only small incisions, not big incisions, releasing the tissue, using these endotines to get the height, shape, and contour we want. Those endotines will gradually shrink and disappear over about 6 months' time. And but the brow stays in position because it's healed down to its natural tissues on its own. And the stitches are all dissolvable. You never see the incision lines. They just fall out on their own. So, and the whole procedure takes about 30 minutes because there's not a lot of cutting. So you don't need a lot of stitching. And that's what really takes, the longest time of surgery. The manipulation and, lifting is very quick and easy.
So how far back do you have to go? I mean, you just go like into the hairline. You just go right up to the top. I'm asking because some of the men listening who may have receding hairline or might just shave their hair, and they're might be wondering, well, where are my marks going to be?
Right.
Other people have hair to hide it. Is it going to be maybe
these
something that'll heal?
Well, these small incisions, if you have hair, we make it just in the front of the hairline. The closer you are to the brow, the more accuracy you have in terms of the lifting and shaping.
Okay.
So we don't want to go further back in the hairline than, we want to go right at the front, sort of in that first centimeter or two of hairline. If somebody doesn't have hair, and that happens, you can still do an endoscopic brow lift. You just choose sort of a natural crease in the upper part of the forehead, and you keep the incisions small. They're about a centimeter in length. And so even, with good closure, you'd have stitches there, a small little area of stitches, but it heals quite nicely. You might have a little redness for a few months, and then that fades to a very fine white line. And so you can do it on patients who are bald. It's way better than an open brow lift because you're dealing with a couple small little incisions, which you could hide in natural creases versus a large incision, which, obviously you would never do on somebody that was bald. So it's made this an operation that's, available to everybody. And then the other point I was going to make is then once you're done with the brow lift, so we do the brow lift first, of course, lifts up the brow and the brow fat pad and gives you that nice contour around the eyebrows. And it greatly reduces the amount of loose skin in your eyelid. And so although I will pre-mark the eyelid, once we finish the brow lift, we go back and remeasure and adjust those marks because then we're really just removing the extra skin that's left in the eyelid, which typically is a lot less than what you started with because most of that's been recruited up as the brow has been lifted. And so it makes the blepharoplasty, or the upper eyelid surgery, a much smaller procedure because then we're removing just a small amount of skin in the upper eyelid, not a large amount, trying to compensate for that heavy, droopy brow.
Okay. You mentioned something about hiding the incisions and natural creases and how so everything looks natural. That's one of the things that you do in the lower face and neck lift too. That's different. That people will look at you and they're like, I don't see that. You haven't lost your earlobe, or I don't see the incisions because of newer techniques with that as well. Yeah,
we use the word natural a lot, but it's an important term. You want to have natural results. People's biggest fear with surgery is looking unnatural, looking different, or looking surgical. And nobody wants that. And obviously, with modern, these modern techniques, we have so many great tools and techniques. You can achieve great results and not look very natural, not look artificial. And so part of the key there is, hidden incisions. Obviously, in a lower face and neck lift, we don't want anybody to see incision lines. So we hide them inside the ear or on the back surface of the ear, in the edges of the hairline. Everything has gotten better over the years. So people that had facelifts 20 years ago, 30 years ago, may have very visible incisions because at the time that might have been state of the art. People didn't care that much about it, or surgery wasn't as refined or sophisticated. But today, that's not the way we do things. We do them with very hidden incisions so that, you can wear the hair the way you want and people shouldn't see the incision lines. And, that's all very achievable. And, endoscopic brow lifting has made a big difference in that regard because now we're doing these very small incisions in the hairline, not large incisions. So that makes a difference.
Let's talk a little more about the lower face and neck lift. That's kind of the bomb right there, right? When it comes to facial rejuvenation in the form of surgical.
Yeah, I look at the face in terms of thirds. There's the upper third, which we just discussed, which really is the upper eyelid brow. There's the middle third, which is a complicated portion of the face. That's the lower eyelid. That could be fat pads. It could be the dark circles where you're hollow. It's, deflation of the cheek. We had, 20 years ago, maybe 25 years ago, it was very popular to talk about mid-face lifting, where we would dissect and lift the cheek. which, was a procedure that was very popular for a while because it made everybody look better because the cheek would swell from that and it would be swollen for a few months and that would make you look really good. And it turned out the best value of that was actually the swelling because that made you look more youthful. We realized that because we now realize that it's volume loss that is affecting that area. So now we don't do many mid-face lifts because we can correct that with fillers and fat. You're replacing that lost volume, taking away the hollowness and that flat cheek area. And then there's the lower third, which is the lower face and neck. And when you do a lower face and neck lift, you're not only correcting the neck, improving the jawline, but you do correct the mid-face too. You are lifting the mid-face if you do a thorough release of that tissue. So you're lifting the cheek fat pads as well. And so a mid-face lift for me is done with a lower face and neck lift and then supplemented with either fat augmentation or volume to give patients that more youthful shape to the cheek, correct the dark circles under the eye, give them that more youthful fullness to the lower lid mid-face region that is youthful, which we lose with age.
Right. And then when we're talking about, we're going to have to take a break here in a minute, but when we're talking about the lower face and neck lift, we are talking about the jawline. We are talking about laxity is it just the jaw or is it the neck as well?
No, neck as well. Lower face and neck are done together. And, we do some mini lifts. We do some isolated neck lifts. Those are very sort of special circumstances. The majority of patients, lower face and neck is done together. And that's the most powerful procedure because that gives you the most flexibility to correct things in the most complete and long-lasting way. So we can kind of get into the details of how that works.
Okay. So we're going to take a break here, and we teach you a little bit with the lower face and neck lift because I know that a lot of people, that's where they're seeing it, and they're like, I don't like that waddle, or I don't like my jowling. And
that's what brings people in, the neck. They see it in the neck in a photograph, and they're like,
what happened?
Yeah, where did that come from?
All right, you're listening to Look and Feel Your Best with Dr. Patrick Flaharty. I'm Gina Burch. We'll be right back. Welcome back to Look and Feel Your Best with Dr. Patrick Flaharty. I'm Gina Burch. This morning we are talking about surgical rejuvenation, and we started at the top, and now we're down to the lower face and neck, which, like you said, everyone says, I don't like or a lot of people come in and they don't like what is happening, how gravity is starting to pull their face down.
Right. Yeah, the laxity of the neck bothers people, and sometimes people say, oh, I just want my neck tightened, I don't want a facelift, I just want my neck. But when you start really looking at them, the jowls, you can just feel, the looseness in the lower face and neck. So, the gold standard is what we call the hidden incision lower face and neck lift or rejuvenation. And that's a great procedure that allows us to correct the mid-face, the lower face, and the neck with a single procedure, all with hidden incisions. So unlike the endoscopic brow lift, where we can make tiny incisions hidden in the hairline, not remove any skin and lift and reshape the brow to the desired result, with the lower face and neck, once we've released the skin and done a deep tightening of the face, and that's where the work is done at the deeper levels to give you that kind of tightening of the jawline and neckline, you've then created a lot of extra skin in most cases, and so then you have to trim out that skin. And that skin is trimmed out kind of around the ears. And as I mentioned, the incisions are hidden. They're hidden in the hairline. They're hidden inside the ear, on the back surface of the ear. And these are all closed with dissolvable stitches as well. So part one is good incision design so that the incisions are hidden so you don't see the incision lines. Part two is, you release the skin to the extent you need to based on, what the patient is. And, we're all so different. We're all built so different. Some people have this very firm tissue that, is easy to tighten. Other people have skin that just stretches and stretches, and they just have lots of extra skin that you have to deal with, and everywhere in between. So some of the other things we look at with the lower face and neck, one is fat in the neck. So we use liposuction to help reduce extra fat in the neck, which is just sort of a delicate procedure that helps to reduce some of the fullness below the jawline and improve the definition of the jawline and neckline. But once we've done sort of made our delicate hidden incisions, released the skin, done the lipo if we need to reduce the fat in the neck, we do a deep tightening of the face and neck, which is really important part because you want to give a nice tightening of the jawline and neckline, but you don't want any tension on the skin, no telltale signs of a facelift. So we do that at a deep level. And once we've done that, then you've created this extra skin, and then you can delicately trim out the extra skin around the ears and do a very delicate closure so that the incision lines heal very well and you don't have tension on the skin or minimal tension. So it
look windblown.
Looks very natural. Yeah, not windblown. So again, old style facelift might be, make a small, make an incision and then without undermining, much, just trying to tighten everything by pulling the skin. And that just doesn't work well. It doesn't give you a good result, doesn't last long, and gives you tension on the skin that looks unnatural. And those are completely avoidable with good technique.
Another thing that kind of helps in the process of lifting all of this is when you do some fat augmentation, and you do that in the cheeks in particular. We'd mentioned earlier how in the mid-face that one of the big problems there is volume loss, and you fill that volume in, and it kind of lifts everything and fills everything out a little bit more.
Fat is like the secret weapon now, and I mean that seriously. So if we do, let's say, a brow lift, eyelids, face and neck lift, and then if you look at that patient, and if that patient is 50 or more, then they have a lot of fat loss in the face. If you compare that picture at age 50 or 60 or 70 to when they were 20, their face is significantly different. Part of that would be, bone redistribution or bone resorption, but a lot of it is fat. They lose that, plush envelope of fatty tissue that fills out the face. It gives, somebody who's 20 this nice, round, full face. And we can restore a lot of that using their own natural fat. So what we do with fat augmentation is I harvest the fat at the beginning of the procedure from the abdomen or flanks. You just use a little delicate liposuction to harvest the fat. We spin it down in a centrifuge to concentrate it. And then we use that fat to replace the volume. And so how popular fillers are. Everybody and their brother is coming in for fillers because fillers can add volume back and make you look younger.
Fill in the creases too and everything.
Yeah, not just filling in lines and creases, but filling in dark circles and lifting your cheeks and filling in hollow temples and strengthening your jawline. These are all areas we see as we age, as the face loses volume. And so... and with fillers, a typical case might be we might do 4 cc's of filler. We might do the cheeks and the creases around the mouth. And people look good instantly, and that's what makes fillers popular. They leave looking younger than they came in. But with fat augmentation, we'll do the whole face at once. I'll do 40, 50, sometimes even up to 60 cc's in one setting. And the value of that is twofold. It's more natural because we're replacing your lost fat with your own natural fat. And it's permanent because fat is living tissue. So we're taking living fat cells from your abdomen or flanks, and we're placing them in the face to correct volume loss. And not all of those fat cells will survive the transfer, but with modern, really good modern technique, we get about 70% survival. And so you get a significant volume augmentation. And a typical case will be, for me, it will fill in fat in the temples and the upper lid brow area. So, that area tends to, a lot of the aging with deflation around the eyes is loss of volume around the eyes. So upper lid brow, which nicely lifts and fills. Sometimes we can just lift the brow with fat augmentation alone. We don't need to do a brow lift because when you add volume, it will lift the brow. Same with the temple. And the lower lid, which can get hollow. So again, we can do that with fat. We don't need to do it with fillers. And the cheek is a huge area, adding volume through the cheek to give you that lifting, filling, and that sort of rounding of the cheek, that loss of that. Our cheeks become very flat with age, and that makes us look older. And then around the mouth, we'll add fat along the jawline to give you that softness and fullness of your jawline, as well as, upper and lower lip and the areas around the mouth, which can deflate, including the lips themselves. Fat works great to give you a permanent augmentation of the lips, so you can add some volume back to the lips. So really, we're replenishing this volume throughout the entire face, which gives you that filling and plumping that makes everything better. No matter what else you've done, when you add fat, people look younger, they look healthier, they look better. And so that is really a key element of modern facial rejuvenation. If you think about doing an endoscopic brow lift as an upper face rejuvenation and a lower face and neck lift for lower face, fat is sort of the missing piece that addresses not only the loss of volume in the middle of the face, but also replenishes that lost volume in the upper lid, lower lid, jawline, around the mouth, and just makes you look younger and smoother. An older style facelift, you might see somebody who's older, who you can tell has had work done, but their face is very thin. There's a lot of wrinkles. And yeah, their jawline is tight, and they look better than they would if they hadn't had surgery, but it's not 100% because they might have sun-damaged skin, but they also have this thin kind of, everything's tightened. It's like tight skin over the bone. Fat allows us to get away from that. It keeps that softness by adding that volume back to the face.
Goes back to what we were talking about at the beginning, that three-dimensional look.
Right.
Which is natural.
Right. And softening. It gives you a softer appearance, which is also appealing, youthful and natural, which really helps.
So let's kind of look at it so if I would just come into your office on a regular basis and say, I need some cheek lifts, I need some lines filled in, what approximately how much filler would you use for just a regular non-surgical office procedure?
Yeah, so in the office,
compared to
right. I mean, in the office, I like doing kind of a little bit at a time. That's sort of my approach because, of course, people can come back in a week and do more.
Sure.
So it's not like in surgery where you have this couple of hours you're trying to give the best rejuvenation. You pay a lot for that time in the OR. You're trying to make the most of it. So the beauty of the office approach is that you can go a little bit at a time. So it just depends on what the patient needs. We'll talk to them. We'll look at them. If somebody's very hollow, but they don't want to do fat, they want to do just fillers, we might consider something like Sculptra, which gives us we can treat the whole face at once. It's more of a gradual building up of volume. But if we're using traditional fillers sort of with that instant result, we might use 2 cc's for the cheek, 1 for each cheek. If they have hollow temples, we might use 2 cc's for the temple, to correct that hollowness, and probably 2 around the mouth. That's sort of a good starting point.
So that's significantly more than what you would just get on an office visit for fillers.
Well, that would be like 6 cc's would be, kind of more of a comprehensive treatment for fillers versus, fat would be 40 or 50 cc's, right? So you're talking about a 10-fold difference. But the reason, of course, you're doing the surgical. So really, fat is more economical. Really, it's less expensive than fillers,
and it's from your own body.
And it's your natural living tissue, but it does require a surgical procedure, a little bit of downtime. But if you just do fat, there's very little discomfort. There's no stitches. You just have some swelling in the face for a week or 2, and that's it. So it's not a difficult procedure for patients. We usually combine it with something else, either face and neck lifting or laser resurfacing or both to give you the best result. And fat combined with laser is a really nice combined procedure, which we can talk a little bit more about. But for people who've already had, again, that patient who's already had a lift but is getting older, they've lost volume, they've got some sun damage, then if you restore the volume with fat and use the laser to tighten the skin, it's a wonderful combined procedure. Again, no cutting, no stitching. You're just adding volume with the fat and tightening the skin with the laser. And they have a week to 2 weeks of recovery, but then they look marvelous. They have this nice, soft, smooth skin. The wrinkles are gone. Sun-damaged skin is gone. And the face is softer and fuller because we've added the fat back, taking away that sort of harsh, sort of gaunt look that you can get.
And we're going to talk about that laser in the next segment. But the other thing about fat is when you spin it down, it has some type of stem cells or growth hormones or something that really helps your healing process too.
So when you take fat, which we harvest just with traditional liposuction, and we spin it down in a centrifuge, you get this concentration of these growth factors and these active proteins, and that's in that plug of fat. And so we see that in the healing. When you do fat with any other procedure, people heal faster, and especially you can see that with laser resurfacing, which typically takes 7 to 10 days to heal, but sometimes with fat, patients will be healed in 4 or 5 days.
Amazing,
so,
right?
It's amazing, and that's just it's the body's biochemistry. You put all these stem cells and growth factors into the mix under the skin, and it helps that skin heal, in half the time. Quite remarkable. So that's another added benefit of doing those two things together.
See, fat is not all bad.
Yeah, fat can be good. Fat can be your friend.
Fat is your friend in your face, not on your behind. So when you're in there doing the liposuction, can you take a little more? Oh, wait, that's where Coolsculpting comes in.
Yeah, I have patients say that all the time. They're like, hey, take as much as you want.
Yeah, have a field day there, Dr. Flaherty. All right, we're going to take a break. When we come back, we're going to talk about some of that fractional laser resurfacing and the combination with fat as well. You're listening to Look and Feel Your Best Dr. Patrick Flaharty from the Azul Cosmetic Surgery and Medical Spas in Fort Myers, Naples, and Bonita Springs. And I'm Gina Burch. We'll be right back. Welcome back to more of Look and Feel Your Best with Dr. Patrick Flaharty. I'm Gina Burch. We're talking about surgical procedures today, and we really have gone through pretty much everything when it comes to the face, except the skin and laser resurfacing, which is, I think when we've talked about this before, I mentioned seeing a patient of yours at one of your seminars. This was years ago, and I thought, man, her facelift looks good. Because she was a before and after, and you're like, nah, she didn't have a facelift. It was the laser resurfacing. She looked that good. It was that amazing. Tell us about that.
For the right patient, laser resurfacing can be remarkable. And laser resurfacing has gone through continued evolution, too. It became very popular in the early 90s when we started applying CO2 lasers to the skin and recognizing that the heat of the laser could give wonderful rejuvenation. Kind of like a chemical peel, but with a laser instead of a chemical.
Right.
So you're eliminating the surface layer, the epidermis, which is where a lot of the brown spots occur. So you get rid of all the sunspots in a single treatment. And then the heat from the laser would tighten up the collagen in the dermis. It could shrink the collagen by 30%. And so you think about tightening up that skin 30%, and lo and behold, 90% of the wrinkles would go away. The early generation of lasers were pretty aggressive. They, would take off the entire skin. They would tighten the skin, and then the new layer of skin would have to heal. And that skin could take 10 to 14 days, sometimes even a little longer.
Sounds painful, too.
It wasn't really painful if you treated it the right way, which was with occlusive dressing, something I believed in since day one, which is, when you do a laser, you want to cover the skin with a little bandage so that you have sort of an artificial skin there. That helps the underlying layer heal better and keeps the patient very comfortable.
Okay.
But then, the downside to traditional aggressive CO2 laser resurfacing was, 2 weeks to heal, redness for anywhere from a few weeks to up to 6 months, some skin sensitivity. With that, hypopigmentation, when the skin would heal entirely, sometimes the skin was a little lighter than when it started, especially in fair-skinned patients who have good pigment to begin with. If they're Mediterranean or tan easily, that was less of an issue. But fair-skinned Caucasians could have their skin be a little bit lighter, what we call hypopigmentation, because they'd lose some melanocytes. Because the laser was so hot, it would destroy some of the melanocytes, so they wouldn't have the same level of pigmentation afterwards. So those are some of the downsides, and those have largely been addressed with fractional laser resurfacing. So fractional laser, rather than removing the entire envelope of skin, you can remove a percentage of the skin. And we have a laser where we can control that. We can do complete ablation if we need it, or partial ablation. It can be as much or as little as you want.
For each patient.
For each patient and for each area of the face.
Okay. Oh, so you can change that as you go.
Yes,
you can change the settings.
Yep, you can adjust it to what you need.
Okay.
So areas that tend to, you need more aggressive treatment would be sort of that middle of the face, the central forehead, the nose, the eyelids, and the around the lips and the medial cheeks.
We have a lot of sun damage and things
more
like that.
More sun damage, thicker skin, more wrinkles. If you look, the skin kind of in front of the ears often is a little better than the skin kind of in the central cheek that has more sun exposure.
Yeah.
And so the fractional laser has allowed us to do, get very similar results because we can get still elimination of the sunspots. We can get still the heat generating to tighten the skin and reduce the wrinkles. But the level of heat energy that's delivered to the skin is much, much less because we're doing it in this fractional mode, which means patients heal a lot quicker, 7 days, sometimes 5 days, not 2 weeks, more like, 5 to 7, sometimes up to 8 or 9 or 10 days. But that's kind of the outside envelope. And then the redness fades a lot quicker, typically in a couple of weeks to up to a couple of months. We don't see that prolonged redness. And the hypopigmentation hasn't been an issue because we're not heating the tissue. We're not overheating the tissue, I would put it that way. So we're not destroying melanocytes. So the skin comes back to its fairly normal color once you've healed. And so that's made this a much more popular procedure. The other really beautiful thing about that is now we can do it because you can control these energy settings so much more accurately, you can do laser resurfacing with facelifts, which in the past was a little bit dicey with the energy being so high. You know, if you're doing a lower face and neck lift and treating the face with a laser, some of these areas around the ears where you've released the skin, it could be too much treatment, and then the skin is slow to heal. And so that was an area that just I wasn't comfortable doing with the older lasers, because sometimes people would slow to heal or even increase your risk of scarring around the ears where the incisions were, which obviously we don't want. But with this new laser, the energy is so well controlled that it's very safe to do these together. And that means you can do all this treatment at once and people heal in that 2-week envelope. And so that's really a key concept. We've talked about harmonious rejuvenation for a long time, and that means doing things in a way when it heals, it all blends in and looks great,
right?
And not like redecorating a room and leaving an old chair. You know, if you do part of the face, let's say you do the brow, face and neck, fat laser, but you don't do the eyelids. Well, and if the
That's
eyelids
the old chair.
then you look in the mirror and go, gosh, you know, my face looks great, except for my eyelids. They're really heavy and hooded, or, you know, so being able to address everything at once. And a lot of times that would have been the skin. If we did, you know, brow, lids, face, neck, fat, and the face looks great, you know, beautiful brow shape, eyelids look great, great jawline, great neckline, but you've got this sun-damaged, wrinkled skin. You know, that's what you see,
exactly.
right? And we used to have to stage it where 6 months later we'd come back and do the laser to finish the skin. And that's fine. You can still do that. But then, you know, again, you're having a second procedure and you're still going to have that week of 10 days of downtime. But now you can do it all together so that by 10 days, you're good. Everything looks good. And it's really made a huge difference. Each time we've been able to incrementally add one more thing that solves one more problem, it just makes the result that much better.
And the thing with the laser is it is a surgical procedure because you are removing the skin. So you can't just go into the office 6 weeks later or a into 6 months, say, okay, let's do that laser. Like, no, we got to go back into the surgical center and do the whole thing again. Right.
And, you know, as we've talked about in other shows, we do have a lot of office-based technologies to help you with your skin, but none comes close to rivaling the degree of improvement you can get with fractional ablative resurfacing. And again, for the right patient, if somebody has just mild sun damage, then we can treat that in the office. They don't need to have the laser. And I think our office-based instruments get better and better. So there's more and more patients that can do that sort of non-ablative or minimally ablative platform. But, you know, again, for that one-time only treatment, you want to look, $1 million, you want everything to look great, then combining these together really is giving us results that we just couldn't achieve before. So if you look at traditional kind of surgery where we might do a brow lift and a face and neck lift, and yes, the eyes are more open. Maybe you've done the eyelids too. The jawline and neckline look good. But a lot of those patients will have hollowness of the face. They may look a little bit gaunt or deflated. The skin may be sun damaged. They may have brown spots or wrinkles. So those are the things that still are there. Now we can do fat augmentation, correct all that volume, or at least to a large extent, give them, you know, a softening and filling to take away that hollowness and gauntness, and then do fractional laser resurfacing to get rid of the majority of the sunspots, the majority of the wrinkles. And these technologies with the fractional laser, you're not going to get rid of every last wrinkle, but that's important too because people need to look natural. They got to look not overdone, right? And but you can get rid of 70, 80, 90% of the wrinkles. And then when they heal, it's unbelievable. You know, I mean, the shape is good, the volume is good, and the skin looks beautiful. And it's just so remarkable to see this incredible transformation. People look 20 years younger, but they still look natural. They don't look different because it's done in a very natural way, just the restoring the lost volume, restoring the youthful skin, and restoring the youthful contours can all be done in a way that's very natural now.
And the fractional laser resurfacing is something that's good for people who've had facelifts in the past, and they're starting to notice some laxity, and they're starting to notice the skin damage or the sun damage, where they could come in and get this done, get their face taken care of, and then at the same time add on to it some fat augmentation,
Right.
because that fills them back up, which even after you have that surgery, if it was 10, 15 years ago, you're still losing the volume. That doesn't stop, right?
That's right. So I think fat augmentation with laser is a procedure I do a lot, and I think it's the reason I do it a lot is we have a lot of patients who've had, face and neck lifts. Maybe they've had their eyelids, maybe they've had their brow done, but they've had this surgical tightening, and they feel like, well, gee, I feel like I have this happen all the time. People come in and say, consult is for a facelift, and I start talking to them, and they've already had a facelift, and it might have been 5 years ago or 7 years ago or maybe 10 years ago, but it's holding up well, and they don't really need another facelift, but they have hollowness and they have sun damage. And so, the good news is we don't need to do another facelift. All we really need to do is let's add some fat to soften the appearance, to get rid of some of this hollowness, and then use the laser to tighten up the skin, to get rid of the sun damage and the wrinkles and the sunspots. And that combination gives great results for people who've already had a lift, because it, really addresses the issues they have. Not just repeating the same thing. I actually had a guy come into me several years ago who had 2 facelifts and was coming in for a consult regarding a third facelift. And he really just had a hollow face, and and all we did for him was fat, and it worked great, and he looked good.
Loving you for that. Like, thank you for sparing me.
Right. So facelifts are great, when they're needed, but they don't solve all problems, and we have more sophisticated tools now, so we have to look at what's going on with the face and where what's the best approach to give them the result, that they're looking for.
And then we go back to something that we talked about the last segment, was when you do that fat augmentation and you do the little liposuction and you spin it down into the centrifuge and you pull out the good stuff from it, because there is some good stuff in fat. We're talking about the stem cells and the growth hormones and those type of things. Then it helps that laser heal better. It
does. Yeah. So doing the two together is like remarkable, because it's just heals sometimes in half the time, which is really pretty, it speaks to the power of, your own healing capacity. So that's what makes fat fun, because we're taking your own natural living cells and we're using that to help not only rejuvenate the face, but help you heal faster as well.
When did you ever think you were going to say fun and fat in the same sentence?
Fun and fat in the same, yes.
Makes fat
Indeed.
Fun.
Not all fat is bad.
No, it's not.
Yes.
And that's the thing. We want it in our face, and then to get rid of it in the rest of our body, you've got the Coolsculpting, which is a whole nother segment that we've talked about a lot, and I'm sure we will do again in the future.
Right. Yeah. It's funny because sometimes people come in and they, we talk about facial rejuvenation and Coolsculpting. I'm like, let's wait on the Coolsculpting until after we get the fat we need for rejuvenating the face, and then you can Coolsculpt to your heart's content.
All you want. Yeah. That's right. Well, if you want to know any more about some of these procedures that we've talked about today, you can always go to azulbeauty.com. AZUL, azulbeauty.com, or call Dr. Flaharty during the week at 239-415-7576. Now, he's not going to answer. Act like, call the doctor up. But one of his team members will. 239-415-7576. Again, there's offices in Fort Myers, Naples, and Bonita Springs. It was lovely seeing you again this morning.
Good to see you, Gina.
And we will see you next week.
Look forward to seeing you next week.
All right. You're listening to Look and Feel Your Best with Dr. Patrick Flaharty. I'm Gina Burch.